I'm Stephanie Peterson. I'm a professor in the Department of Psychology at Western Michigan University, and my training and doctorate is actually in special education. So I've been trained as a special ed teacher, and I'm a board-certified behavior analyst. My area of research is working with children who have mostly developmental disabilities, but I've also worked with a lot of kids who have other types of disabilities, like learning disabilities or communication disorders, behavior disorders, things like that. And I've worked with individuals who are, I think one of the youngest kids I've worked with was 20 months old. I'm trying to think the oldest individual we've consulted with at KCMH is probably 60-something, so pretty broad range of age. I would say that my concentration is probably in the school-age population. Children who are anywhere from kindergarten through 6th grade is kind of the area I tend to work in. And I'm really interested in children who display chronic and severe problem behavior that require some sort of behavioral treatment, and I'm very interested in both looking at ways we can better assess why those problem behaviors are occurring and ways that we can intervene with those problem behaviors that don't involve punitive procedures, and to the best of our ability try to avoid the use of extinction if we can. And if you're not familiar with extinction, that's just no longer reinforcing a behavior that used to receive reinforcement. And one of the reasons I've been concerned about extinction, I mean, it's often a very necessary and important part of a treatment package, but we've run into a lot of situations where when we try to do extinction, as you may know, you often get a little burst of problem behavior when you first start implementing extinction, and sometimes those bursts just aren't tolerable for one reason or other. Either the behavior itself is so significant that you can't risk it, or the individual's 180 pounds and bigger than you, and the target behavior is aggression, and you simply can't engage in extinction because you're too busy protecting yourself or other children, perhaps, from harm. So we've tried to look at ways that we can set up competing schedules of reinforcement and avoid the use of extinction if we can. So I'll show you a little bit of some treatment that we've been working on with kids, and I have a reference to my website where you can get more information on that if you're interested. We're still trying to further that area of research at this time. So what I thought I would do today is just go through functional analysis of problem behavior and what a functional analysis looks like. I understand you guys have some behavioral background, some training in the behavioral principles. I don't know what level of experience you have actually conducting a formal functional analysis. Can you give me a feel for?
We've done a few in the clinic. So Chelsea and Christine have both participated in data collection. Actually, Dr. Samuels has too.
Okay.
And sometimes being the implementer. So we've rehearsed it and had the bug in the ear to coach them. Okay,
cool. So you have a little bit of experience, and then some people here maybe don't have experience doing that? Okay. So I'll walk you through how we do it, and at least you probably know that people do them slightly differently depending on who trained you too. So this is not the only way people do it, but it's the way we tend to do it. It's sort of the general strategy that we use. And then I'll show you we'll talk about how that leads to treatment of problem behavior. So first of all, let's just clarify what we're talking about when we talk about problem behavior. When I'm talking about it, I'm referring to fairly intense problem behavior such as self-injurious behavior, kids who are banging their heads, picking their skin, poking their eyes, and so forth. Children who are engaging in aggression, hitting, kicking, biting, spitting, all that fun stuff toward others. Property destruction, destroying task materials, destroying classrooms, destroying their bedrooms, destroying their homes. And then non-compliance, just refusal to complete tasks that they're being asked to complete. Usually this takes the form of children throwing themselves on the floor, kicking, screaming, running away from you when you attempt to redirect them back to the task. And as you guys probably are well aware, individuals who have developmental disabilities often engage in these kinds of problem behaviors. In particular, children with autism very frequently have these kinds of problem behaviors. And there are several hypotheses why these problem behaviors occur, and Ted Carr in 1977 sort of was one of the first people who really started talking about this in an article that he published. And he put forth several hypotheses for why these behaviors could occur. And one of those hypotheses was an operant hypothesis, meaning that the behaviors serve some sort of environmental function or purpose for the individual. And there's basically been 4 general functions that we tend to look at as potential functions for problem behavior. A positive social function, a positive non-social function, a negative social function, and a negative non-social function. So let me just run through each of those and say what I mean by those. So a positive social function for problem behavior would be that the child is engaging in these behaviors because they've in the past resulted in delivery of positive reinforcers such as attention, access to preferred toys, and so on, maybe access to preferred foods. And the attention isn't necessarily been positive attention. It may have been negative attention, as some people would define it. So reprimands, discussion about why that behavior is inappropriate, and so forth, but nonetheless, attention that they've received for this behavior. A positive non-social function would be, you guys may have heard this referred to as an automatic function of the behavior. That is, the behavior in and of itself is positively reinforcing. So the behavior produces its own reinforcement, and in this case, the reinforcement it produces is like a gain purpose that, maybe I rub my hands because I like the feeling of that, or I rock because I like the sensory stimulation that that provides. So I'm gaining something from engaging in the behavior itself. And it's non-social because somebody else doesn't have to deliver that, okay? Whereas a positive social function is mediated by other people. So if I throw my chair across the room, it produces a lot of attention from the adults who come over and pay attention to me. So it's mediated by other people, not produced by the behavior in and of itself. A negative social function would be that the behavior allows the individual to escape or avoid the presentation of a non-preferred stimulus. So, for example, I rip up my work and throw my pencil across the room because it means you go away or put me in timeout and I no longer have to do the work, so I've escaped it. A negative non-social function would again be a non-socially mediated function, again, where the behavior produces its own consequences, but in this case, the consequences are allowing me to escape things. So, for example, I might engage in screaming and rocking to block out stimuli that I find aversive. Not necessarily because I like the feeling of rocking, or I like the sound of my voice, but because it helps block out stimuli that I don't want to hear, okay? So we look at that as a negative non-social function. And a functional analysis is simply an assessment methodology that allows us to empirically validate or identify what, if any, of these functions are maintaining a problem behavior. It was first developed by Brian Iwata in 1982 when he published a seminal article on this, and as you're probably well aware, this has produced an enormous amount of research in the field of developmental disabilities. The assessment technology has been replicated across a wide variety of topographies of problem behavior, different populations of individuals, different age groups, different settings, and it's been shown to be very robust in terms of its validity of identifying the function of problem behavior. And as a result, it's basically become a best practice standard that we engage in this kind of assessment before we develop a behavior treatment plan. And it's been a pretty cool development in the field because it's really revolutionized how we think about treatment of problem behavior. instead of simply thinking about how do we reduce these problem behaviors, it's changed the mindset of caregivers to say, what are the reinforcers maintaining those problem behaviors, and how can we change what those are contingent upon to produce more adaptive responding, instead of just sort of taking a punitive approach to problem behavior. So how do we go about conducting an FA? When my group does an FA, we don't just jump right to a functional analysis. There's usually a number of steps we take before that. One of the steps that we take is to conduct a structured functional assessment interview. And typically we're using the interview that was developed by Rob O'Neill and his colleagues in 1991, I think, called the Functional Assessment Interview. And we use that interview to try to make hypotheses about why we think the problem behavior is occurring. Then we usually go from there to conducting some observations under certain situations. Sometimes we'll start, I have my next bullet here says under highly controlled situations. Often there's an intermediate step in there where we go in and observe the behavior under unstructured situations, just sort of a natural routine, and we'll do what we call an ABC assessment, where we look for every time the problem behavior occurs, what immediately preceded it and what immediately followed it. And we do that because sometimes care providers, when we do the interview, they either aren't able to provide us with a lot of information to guide our hypotheses, or they're just not sure themselves. Maybe they haven't paid close attention to the kinds of things that we're asking about. So sometimes we'll go in and make those observations ourselves. And sometimes they are consistent with what we heard in the interviews, and sometimes what we see is inconsistent with what we heard in the interviews. It's not uncommon for a teacher to tell us, here's what I do when problem behavior occurs. This is the intervention we're running. But then we go watch, and we actually see they're doing something a little bit different than what they're reporting they're doing. And they may not be aware that what they're doing is something different than what they're reporting. So I'm not suggesting that they aren't being honest with us. I think sometimes we just aren't always paying attention to our own behavior as well. And so often what we do is then go on to a formal functional analysis where we actually conduct an assessment under really highly controlled and structured conditions in order to test our hypotheses about what's maintaining the problem behavior. I have found that this is the most efficient way to get at your question about what's maintaining the problem behavior. A lot of times when we make observations under natural routines, there's a lot of variables changing at the same time, so it's often difficult to pinpoint what the exact antecedent was and what the consequence was, because maybe the consequence was, well, first the teacher had a discussion with the child about their problem behavior, and then the teacher put him in timeout, and a number of things might have happened while they're in timeout. So it's really not clear if what the consequence was timeout, or was it the discussion, or what role each of those played in maintaining the behavior. So it's very often necessary for us to really test our hypotheses. So the structured conditions that we tend to implement on a regular basis are as follows. We will often start with what we call a free play or control condition. If we're working with adults, we call it a control condition. Free play doesn't seem very age appropriate for an adult, so we tend to call it a control. And it really does it. The function of this condition is to serve as our control condition. This should be the condition in our analysis that ideally would produce no problem behavior. There should be no motivation for a child to engage in problem behavior in this condition, because we are basically saying there's no demands on you, so there should be no reason for you to engage in negatively reinforced problem behavior. I'm going to play with you one-on-one, so there should be no reason for you to engage in attention-motivated problem behavior. And we're going to have access to all your preferred stuff, and you can do what you want with it. So there should be no reason to engage in behavior motivated by access to tangible items. So we try to design this condition to be what would be the ideal conditions for this kid. Some kids with autism don't really like a lot of intense one-on-one attention. So it won't look like I'm in your face trying to play with you, free play. It'll be the child has their preferred toys. I'm here. I'm available to talk to you if you want me to, but I'm not going to force my attention on you if that's an undesirable to you. So I'm going to design this condition to what one of my doc students once called the carnival condition. You know, it's adults making a fuss over me doing whatever it is I want to do. Okay. Then we will often do what we call a contingent attention session, and this session looks exactly like free play, except the adult says, I've got to go do some work over here in the corner. You keep playing. Okay, so there's still no demands, there's still access to those preferred items, but the adult goes and diverts his or her attention by pretending to read a book or do some work, and as long as the child plays appropriately, he or she is ignored. If a target problem behavior occurs, the adult will approach the child and provide some form of attention. Now, the attention will not necessarily be, oh, good job, you just threw the chair. Instead, it would be some kind of attention that would mimic what typically happens in the natural environment. And this is where your interviews and your other observations that you conducted paid off, because you can go, okay, here's what I saw happening in the typical environment, that's what I'm going to do here. So if I noticed that the parent or the teacher would often go over and provide discussion, now, why did you do that? You know we're not supposed to throw chairs. What's the more appropriate thing to do? You know, a little discussion like that with the child. So that's what the form of that my attention is going to take during this. So I might provide attention for about 10-15 seconds, and then when the child is not engaging in problem behavior, say, okay, I'm going to go do my work again, and walk away. And we repeat that little sequence during this condition. And if the problem behavior is motivated by attention, we should see increases in problem behavior in this condition. If attention is not a motivator for the problem behavior, we should not see problem behavior in this condition. So we're looking for where do we get those increases. Another condition that we'll conduct we call contingent escape. So this one is really testing that negative reinforcement hypothesis. So in this condition, playtime's over. We're now going to do what I want to do. So with young children, this typically looks like if they were just playing with blocks on the floor, we might continue to play with blocks, but now it's not child-directed play, it's adult-directed play. And I start telling the child, no, let's do this with the blocks. Let's put them this way. I want to stack them. No, I don't want the red one next. Put the blue one on next. So I become very directive in how we're going to play this game. With older children who are school age and engaging in school work, I would use a school-related task here. So a math worksheet, a reading task, a writing task, whatever is a task that's been identified as one that seems to trigger the problem behavior. So I'm going to ask the child to engage in this demanding task. I'm going to provide continuous attention during task engagement, although my attention is in the form primarily of delivering task prompts. Right? Okay, let's do this problem. That's not correct. Erase it, fix it. Okay, good. Next problem. Okay? And so I'm just keeping them working on the task. And as long as the child appropriately works on the task, I'm going to keep delivering those task demands. Again, I'm not going to be a mean teacher, but I sort of tell people, you're sort of like the drill sergeant teacher, the one that just kind of keeps you clipping along and isn't necessarily nasty, but isn't necessarily all buttery and nice either. I'm providing some praise and feedback for appropriate performance, but then it's okay, let's move on to the next one. Okay? If I see problem behavior, so if the child throws their pencil or tears up their worksheet, I'm going to remove those materials and turn away from the child for 10 to 15 seconds. So I'm going to provide what I think might be the reinforcer for 10 to 15 seconds, and I'm just going to ignore the child during that time. No attention, no task demands. And ideally, there's no toys around that he can run and play with. So he sits doing nothing. It's basically a timeout. After 10 to 15 seconds expire, I'm going to turn back to the child and say, all right, let's get back to work. If problem behavior occurs again, I'm going to turn away again. If the child starts to work, we're going to keep working. Okay? If the problem behavior is maintained by negative reinforcement, we should see increases in problem behavior here. And ideally, we should see them when I'm presenting the task demands and when I turn away and stop delivering the task demands, the problem behavior should diminish, right? There should be no reason to be engaging in it. So ideally, that's what I'm looking for, is the problem behavior occurs when I'm delivering the demands. When I stop delivering demands, problem behavior tends to go down. As soon as I turn back, it comes back up again, right? So that's another condition we look at. Another condition we do is what we call contingent access to tangibles, and this is to test the hypothesis that the child's behavior is maintained by access to preferred items. So, and this is where I think how we run it maybe varies from what you see in the literature sometimes. So this is how we do it. Again, there's no demands placed on the child. Instead of having their most preferred item to play with, I provide the child with a somewhat neutral item, not a non-preferred item, because then now we're talking about sort of a demand to play with this, but a neutral item, something that they don't mind playing with, but isn't what they really want. And I've got the most preferred item. It's mine. It's my turn to play with that, right? So I'm over here either denying access to that, or maybe I'm even sort of playing with it over here a little bit. And as long as they are engaging in appropriate behavior, they get to keep that toy. If they engage in the target problem behavior, oh, here, play with this for a little bit. And I provide access to that tangible for 10 to 15 seconds, and at the end of that 10 to 15 seconds, I say, it's my turn. Give me the toy back. And if they give it back, I give them their neutral toy and let them play while I take the preferred toy again. And that goes on to test that hypothesis. I tend to interact with the child throughout that session to control for attention. I don't want my attention to only be being delivered when I provide that preferred toy. I want it kind of going on all the time because I don't want that attention as a potential confound. I think that's maybe where mine, the way we do it differs from how some other people do it. Okay? So if the problem behavior is motivated by access to tangibles, we should see it here, right? The final condition is one that was described in the Owada study, and is one that I don't do that often when I'm running an analysis. Let me just, I don't know how to do it on a PC. The big three for us are, we always run free play, contingent attention, and contingent escape, because those are the big three functions that we see. We'll run a contingent tangible if we have a hypothesis about tangibles. If we have no reason to believe that tangibles have any reinforcing value, sometimes we won't run it if we have very limited time. If I have the time, I'll run it just to rule it out. But if my time is really limited, I won't. And this is another one that I only tend to run when I really have a question about this. This is an alone condition where basically the child is in a room alone, so there's no attention possible. There's not even a person present to signal that attention might be available. And there's nothing to do. This condition is really getting at, is the behavior itself producing positive reinforcement? Are they engaging in this behavior to stimulate themselves, give themselves something to do, or because the behavior itself feels good? The reason I don't run this all the time is because when I work with little kids, and even school-age kids in classrooms, how often are kids in a room by themselves with nothing, no one watching them and nothing to do? It seems like it's really a contrived situation that doesn't typically happen in the environment that they're in. So the only time I will run this is if I have a pretty good reason to suspect that the behavior does have a non-social function, and I want to see if it would persist in the absence of any social contingencies whatsoever. So I don't run this one very often for that reason. Now, when we run these, each of these are about 5 minutes in duration if we're working with little kids. If we're working with school-age kids, I might go up to 10 minutes. The reason being, little kids fatigue more quickly and have shorter attention spans. So 5 minutes seems to be sufficient. With older kids, sometimes as you're working on a worksheet, it might take 5 minutes of working on that demand before they're motivated to try to get out of it. So we may do the conditions a little longer. And with adults, we might do 15-minute conditions if we think we need to before the motivation to engage in problem behavior might occur. And we repeat these in a different sequence each time until a clear pattern emerges in the behavior. So what I have here, I've got some videos. They're very short. I need to go back and edit these to make them a little longer because they're almost too short if you ask me. Just to illustrate here, but the videos won't run within the PowerPoint on this computer. So let me just, I'm going to show you some videos of a little boy that I'm calling Mark. It's not his real name. He was about 3.5 years old when these videos were taken, and I was engaged in a class at a university at the time called the Interdisciplinary Evaluation Team. And what this team did is we took 3 children over the course of a semester, and each child got a very good multidisciplinary evaluation. And the students who were enrolled in the class would go and observe each of the evaluations that the child had, and then we had a multidisciplinary team meeting at the end to determine recommendations and so forth, and the students got to observe that as well. So this was a child who was referred to that team, and one of his issues was, so he's got developmental disabilities, as you'll see. He does have some verbal language skills, but they were certainly not up to what they should be for a 3.5-year-old. He also had some fine motor issues. But probably the biggest issue he had, he was had a lot of really challenging behaviors that his parents needed help with. His mom, I suspect, probably had a mild mental disability herself, and she had a lot of trouble managing him. He ruled the roost at their house. And so our role in this assessment was to conduct a functional analysis to identify why these problem behaviors were occurring and to see if we could develop an intervention to help him perform better. You were saying you're low-tech on your video. So I'm going to apologize right now. Some of the quality of this video isn't great. One of the students who's enrolled in the class is shooting the video, and there's a point where she's sliding the tripod all over the place. It makes me crazy. So I apologize for that. And it's also interesting to note that the individual you're going to see running the analysis is actually one of my undergraduate students at the university, and so you'll see that I'm coaching her through it and giving her some feedback. So if you see the two of us talking, it's because I'm telling her what I want to do next, so it's probably not unlike what you guys are doing with Bug in the Ear, except we didn't have that high-tech of equipment. So you'll see that going on. All right, so this first video, oh, and let me tell you what his target behaviors were. So his target behaviors were noncompliance. He would scream and tantrum. He gets up and tries to leave the area. He actually tried to leave the room a few times. And one that his mom reported, and we saw in our analysis, I'm not sure you'll see it in these videos, but he could make himself vomit. So he would go around, and when we were really starting to place demands on him and he wanted to leave, he would start making gagging sounds. He'd say things like, "Give me the trash can, I'm going to throw up." And he could make himself throw up. In our clinic, he didn't do that, thankfully, but that was in his repertoire. So the first clip I'm going to show you is the free play that we were running. And so in this condition, we've got a table full of toys, and my student is just interacting and playing with him. Playing, that's a 5-minute session would go on like that. And if problem behavior did occur, and we did have a couple of sessions where that did occur, it was just ignored, and we just tried to keep playing. We didn't do anything for it. It looks like something mixed up. Hold on one second. This is one thing to go through. So what we do as we conduct a functional analysis is now we go back and we observe each of those 5-minute sessions. We typically do this off videotape because for us it's hard to do sometimes live. So we videotaped these, as you can see, and we would go back and we tend to score it using, in his case, he had multiple topographies of problem behavior, and some of them lasted a long period of time and some of them were pretty brief. So we used a 10-second partial interval recording procedure, which means we took the 5-minute sessions and we broke it up into little 10-second chunks, And every 10 seconds we were marking, during this 10 seconds, did he engage in problem behavior, yes or no? And if he engaged in problem behavior at any time during that interval, we marked that problem behavior occurred. If he was appropriate for the entire 10 seconds, we marked no, there was no problem behavior. And then at the end of the session, we go and we count up how many intervals did problem behavior occur in, out of how many total intervals, and we get a percentage of intervals with problem behavior. And so in this graph will depict for you how our analysis went. So you can see the very first session we ran, this first 5-minute session, was a free play, and we saw no problem behavior. In a minute I'll show you the other conditions we ran, but you can see the sequence that we ran everything in by how we've laid it out on this graph. In the second free play session, we did have some problem behavior. You'll notice that immediately prior to that, we ran an escape condition where there was a lot of problem behavior. Most of that was carryover that occurred at the first part of the free play, and as the free play went on, it sort of went away. And then later when we did another free play, he was fine. So, so that was the results for the free play. Now, next we did the contingent attention session. He plays. There were a couple times he tried to recruit her attention appropriately, like, hey, come play with me. And she just ignored it and kept working because it wasn't a target problem behavior, okay? And if I go back to the graphs, you'll see that the contingent attention sessions rarely produced any problem behavior. I think we saw one problem behavior the entire time we did this. Most of the time he was content to play by himself. Okay? When we ran the contingent escape, it was, I gotta tell you, this little kid, it was like a light switch when you asked him to call it. You can see we started with the free play, we went to the contingent escape, and we immediately got problem behavior in almost 100% of the intervals. And you can see he even cried right through the breaks, right? He's crying and crying almost the entire session. As soon as that's over and we go to the contingent attention where we say, come on over here, you can play with what you want, boom, it all stopped. The next session was another contingent escape, and you see he immediately started screaming and crying. We tried to go to free play, had a little trouble transitioning back to free play, but then he got it under control. We did another contingent attention. He was fine playing by himself. We did one more escape condition and immediately got 100% problem behavior again. So when we looked at this graph, we're like, this is pretty clear what the function of his problem behavior is, right? It's escape. And so each of these were 5 minutes long. We only had 2 hours in total for our evaluation. So we did 5-minute sessions with him. So this took approximately an hour. 45 minutes of session time. There's probably some time in between there where we were transitioning from session to session. So it took us 1 hour to complete that analysis and very clearly identify what the function of his behavior was. This is not one of my graphs. This is a graph from the Iwata et al. 1994 paper, but I just wanted to show it to you to show you an example of if an individual had an attention function, for example, this is what the graph might look like. So all the other conditions have relatively little problem behavior, but we see elevation in the attention condition. So we're basically just graphing those out and looking at where do we see consistent patterns of elevation in problem behavior. So one question people will ask me is how common are these different functions of problem behavior? And if you look at the summary data, the epidemiological data that have been published, you would see that negative reinforcement is, depending on which article you read, it's most typically the most common function for problem behavior, especially the older people get. With really little kids, often we see attention function competing pretty closely with escape functions, but I think it makes sense that as individuals with developmental disabilities get older and the societal demands on them get higher, it kind of makes sense that negative reinforcement tends to crop up as a more common function because they may not have the skills to engage in some of those demands or may not have had the skills to engage in those and learned that by engaging in problem behavior I can escape and avoid those. what I think is very interesting is if we think about schools, what's the most typical intervention schools will use for problem behavior? Yeah, timeout, or suspension, expulsion, right? Which all feed right into this negative reinforcement function. So it's very easy to see how negatively reinforced problem behaviors can get shaped up in school settings. When demands are high, there's a lot of academic demands, and timeout is our go-to strategy for intervention. So those data don't really surprise me that I've seen in the literature. And non-social reinforcement tends to be the third most common. And then in some cases, you actually have individuals who have multiple functions. And it's not uncommon that people have multiple topographies or forms of problem behavior that serve different functions. So for example, it's possible that aggression might serve an attention function and self-injury could serve an escape function in the same individual. Sometimes aggression might serve more than one function, escape and attention, but self-injury only serves escape. Okay, so one thing to consider is if the child has multiple topographies of problem behavior, when we're coding our data, we code those separately. In our case here, everything happened together in that escape condition, so that wasn't necessary. But if I did have a situation where a child engaged in different topographies of problem behavior, such as aggression and property destruction, when I'm doing my analysis, I code those as two different behaviors because I may see them in different conditions, and I want to be able to separate that out. So in that case, I'm going to have two graphs that look like the ones I showed you, one for property destruction and one for aggression. So I can analyze those separately. Okay? There are some cases in the published literature, fewer than 5% of the studies that I've seen, those are the data that have been reported, are inconclusive and show, we really can't make a conclusion about environmental maintenance of these behaviors. Now that may be an artifact of the situation that if I'm getting an inconclusive functional analysis and I am having trouble coming up with good treatment, it doesn't get published, right? We don't always publish our failures. So it may be that there's more than that out there, but in the published literature, they're not that common. So what does this mean in terms of intervention? I mean, doing a functional analysis is cool and it gives us some neat information, but unless we use that to develop an effective intervention, there's really no point in doing it. And this has been one of my frustrations working with some schools, is that they don't necessarily do the functional analysis, but they may do an FBA for a child and then develop a treatment plan that has no relation to that FBA. So the function of the problem behavior is attention, and so we're going to put the kid on a token economy and they earn tokens to buy pencils. It's like something here doesn't fit, right? So unless we use that to guide our intervention decisions, there's no point in doing it. So what we want to do with this, with the functional analysis, is a couple of things. One is, can we identify the conditions that seem to occasion the problem behavior? What are the antecedent variables that are triggering that problem behavior? For example, one reason problem behavior may be motivated by escape is that what you're asking the child to do is so far above their skill level that they can't do it. So they just want to get out of the situation. I mean, have any of you ever been in a frustrating situation and you just want out, right? So it's one thing you could think about is, do we need to modify the task demands so that the child can perform this skill better? Do we need to provide more effective instruction on this skill, whether it's a math skill or a reading skill? Is there something about the instruction that needs to be fixed before I deal with the motivation issues? Part of what we need to separate out is it they can't do it or they won't do it? Okay, and if they can't do it, then I need to start there and deal with that. Is the child, and the second one is one I see a lot when I'm consulting in group home settings. People may engage in attention-motivated problem behavior because they spend very large parts of their day being ignored. And there's very little social attention available. what would happen if I just increased the amount of attention they were getting non-contingently throughout the day? Or had access to more activities throughout the day? It's not uncommon that I go into a group home and see a child or an adult sitting in front of the television for hours on end with really not a lot of other stuff to do. These can be very effective ways of dealing with it and are what many people will call non-aversive treatments for problem behavior. Can we enrich the environment? Can we do a better job on our instruction? And let's make sure those things are all in place before we go any further. Are there certain stimuli in the environment that trigger this problem behavior that we could just remove? And that can be a good strategy. The only problem with that is it still doesn't teach the child how to deal with that when it comes back, right? So that last bullet point I sometimes have an issue with because we can't all live our lives never encountering stimuli that bother us. So we have to have some strategies for dealing with those stimuli. And frankly, I've seen that last one be taken to such extremes that kids are in really barren environments. I've seen a classroom where they had a drinking fountain in the classroom and the kids kind of would go over and splash in that, so they shut the water off to the classroom. So now the kids can't get a drink in the classroom. They have to have scheduled drink opportunities. Teachers said that every time I walked in the room with a salad or part of my lunch, the kids attacked me for it, so we don't allow food in our classrooms, period. You know, it's like, great, you've removed the offending stimuli, but now what happens when a stranger walks in with a little bit of food? They're going to get attacked, right? It doesn't help people learn how to deal with that situation. So although I think that there's a lot of benefit to these kinds of strategies, we probably also need to think about additional strategies. And so another way to approach non-aversive treatment is to think about, can I take what was reinforcing that problem behavior and now make it contingent on a more adaptive response and teach new behaviors so that the kids can, it's okay to want out of a task. It's okay to want attention. It's okay to want that toy. It's not that there's anything wrong with that function. The problem is how you're trying to access it. So let's find a better way to access it. So often this involves teaching kids to make requests. It may teach them other skills that they need to be able to engage in those activities better. And often it is paired with extinction or removal of the reinforcer for the problem behavior. And we sort of talked about that a little at the beginning of this talk. So I'd like to just show you what we did real quickly with Mark, if I have a few minutes. So one of the first things we did with Mark was we wanted to teach him, remember he has escape-motivated problem behavior, and he does have some verbal skills. But I'll tell you what, when he's in the middle of a tantrum, it's not going to be real easy to teach him a verbal skill to say, oh, could I have a break, please? Moreover, it's very difficult to physically prompt that skill. So what we tend to do, even with verbal kids, is provide them with a card that says, break, please, that they can touch. For one thing, the effort is really low to do that, and for another, we can physically prompt that really easily. So the first step that we wanted to take with Mark was to present him with a demanding task. We're going to say to him, you don't have to do it, but tantrum is not going to get it, right? If you want to get out of this, touch the break card and you'll get out of it. And we're even going to make it better. Not only do you get out of it, you can have some M&Ms and some water and you can play bubbles. We're going to really load it up to motivate him to touch that break card. Now, our concern right now is not getting him to do that task. Our concern is teaching the new skill. I could care less if he asks for a break every single time we present that coloring task, because right now I'm trying to teach the break request, right? I'm not trying to teach compliance at the moment. So let me show you what we did. So you're going to see in this video, you're going to see Giselle ask him to color. You're going to see a blue break card on the table. And we're going to be saying, if you don't want to do the work, touch the break card. And you're going to see that at first, he's pretty inappropriate about how he touches that break card. He slaps it, and he says, give me yum yum. Okay, it's really inappropriate. We don't, it's the first time we've tried this, so we're like, it's cool. He touched the break card, right? So he still gets out of the task, and he gets access to those preferred items. Over time, we'll change what the requirements are of touching that break card appropriately, but And you'll see that very quickly he starts touching it more appropriately. So, these are the percent of intervals with problem behavior during the escape condition of our functional analysis, okay? We're just taking those data and put them here as our baseline. This is teaching him to communicate and touch that break card. And what I want to just indicate here is we scored what did he choose each time Giselle presented the work. And that's shown in the bar graph. So here's when he chose to touch the break card. Here's where he said, let's do work. Never, right? But we had no instances of him getting up and running around the room and screaming and threatening to throw up in the garbage can. So that was pretty good. We were really happy with that. And these, I think, were 10-minute sessions, if I remember correctly. So in 20 minutes, we had him pretty well shaped up to touching that card and not engaging in problem behavior, which is great, but as you guys probably know, if we sent somebody back to you with that, you wouldn't be very happy because you're like, yeah, but how are we supposed to accomplish these instructional objectives? So the next thing we did was start to require him to do some work before he could take his break. So what we've done in the next video that you'll see is when he touches the break card, we've changed the contingencies a little bit. He can still have a break, but he doesn't get the yum-yums, and he doesn't get the bubbles. He sits there with nothing to do for a short period of time. I think we did 10 or 20 seconds. If he opts to do the work, and mind you, early on here, we're not going to require much work, right? All he has to do is pick up the crayon and make a mark on the page. If he does that, then he can have the yum-yums and the bubbles and Giselle's attention for about a minute. So what we're trying to do here is say either one of those two adaptive behaviors is cool with us, but you're going to get a lot better stuff if you do what we're asking you to do. Okay? So that's this phase here. And what I want to show you is that he pretty consistently started choosing work in this phase. Sometimes chose break. We had a little bit of problem behavior, but not too bad. We did a quick reversal back to the break where if he touched the break card, he got the toys and yum-yums, and he went back to choosing break. And then we went back to what I just showed you, where he had to do some work to get the yum-yums. And he very quickly started choosing work, and we had very little problem behavior. Just want to show you that here now we went back and he chose, I think we did these two 10-minute sessions back to back, so for 20 minutes straight, he chose work 100% of the time, never had any problem behavior. We had him shaped up to doing 6 or 8 shapes by the end of the session. And so this whole, so what did we have, 9 sessions in the functional analysis, if I remember right, plus 1, 2, 3, 4, 5, 6 sessions of treatment, all within 2 hours. And we made recommendations to his teacher about how to implement this. We got him in a preschool. He hadn't been going to preschool prior to this. She implemented this and had him doing a great job in preschool. And as a 3rd grader, he was actually on, what do you call it? You know, when they do the reading tests with kids, the little reading probes and the timed reading probes, where we were in that state, they had 3 different categories, like you're proficient, you're satisfactory, you're at risk. And we continued this intervention with him, and by the end of the school year, he was actually, he wasn't proficient, but he was satisfactory on timed readings. So that was really cool. And I think they actually ended up removing the developmental disability label from him over time. So I just wanted to give you, this is my website, and on the website, if you, is this computer hooked up to the internet? Sure. If you click on that, let's find out, won't we? It'll take you to my, well, there we go. On my website, there's a, there's a link that says grants, and if you go down here to improving task completion for children with problem behavior, it'll take you to a page that shows you a project we've been working on. We've been implementing that choice-making intervention with a number of children, and we're not using extinction for problem behavior. We actually set it up that they have 3 choices. You can either do your work and get really cool breaks, You can touch the break card and get a moderate quality break, and you can have some toys, but they're not your favorite ones. Or you can engage in problem behavior and you're still going to get a 10-second break, but no attention, no toys. So we're not even using extinction and getting similar results. And on this website you can see, you can go to our grant material, and there's actually a module that you can go through that shows you how we do all those steps. There's video examples of how to do each step. There's data collection forms that you can use. And we have a decision-making protocol in there for how you decide when it's time to fade parts of the intervention. So I just wanted to let you know that that's a resource that's out there if you're interested, and hopefully we'll have some more grant dollars to do that. Maybe you want to partner with us on some of that. That'd be kind of fun. And these are just my references and my contact information. So do you want